Hello, I'm the Healthcare Effectiveness Data and Information Set, or HEDIS for short. I measure and improve healthcare by tracking the quality of care for 190 million people in the United States. That's 58% of the population. NCQA has managed and looked after me for almost 30 years. Recently, NCQA has started making some of the biggest upgrades in my history. My measures are going digital. Digital measures bring new ease and clarity to assessing quality. Here's why. For years, computer programmers who work for health plans have had to translate HEDIS measures into computer code that extracts healthcare information from databases. A big job. Because HEDIS measures have been written in words and not in computer code, the measures could be misinterpreted, especially by people new to reading quality measures. In fact, it looks like a software engineer is reading me right now. Uh-oh, it might take them a while to understand me. Different programmers might understand me differently and program me differently. That's a problem because it makes it hard to compare results between plans. To ensure consistency and apples-to-apples comparisons, NCQA has begun to write measures using a standard digital language. People who aren't programmers can read the measures, but the language is still precise enough for computers to use. Before we take a closer look, check out my new size. I've lost a lot of weight. Now that my measures are digital, I've slimmed down and fit inside a zip folder. Programmers can download me from NCQA and plug my code straight into their computers. It's fast, easy, and doesn't require interpretation. Programmers like to know about the two main parts of my digital format. My quality data model, or QDM, contains the basic elements that comprise a quality measure. Things like procedures, patient encounters, and lab reports. My CQL, or clinical quality language, is the logic that ties those elements together. Here's an example of a digital measure in action. This measure's CQL code tells the computer to look for patients who have a diagnosis of pharyngitis or sore throat. The CQL can tell the computer to look for a specific time range, illness severity, and other data. Then the data can be combined with other CQL classifications, such as doctor visits or medications. If we want to find office visits when the patient had a sore throat, we write it like this. Then the computer looks for these diagnoses in the database. After a measure's data elements are written in CQL, they are translated into file formats that computers can use to calculate and report HEDIS results. So here's what's inside me, or my zip folder. A human-readable file. This makes me easily understood by people who aren't familiar with computer-coded files. A CQL file. This is a list of all my data elements written how a computer understands. An XML file. This is a machine-readable file that stores and transports data. And a JSON file. This is a JavaScript file. It's included because some computers read JSON files easier than XML files. I can't wait to show off my digitalized measures to health plans and others who work with HEDIS. I know they'll like the new digital me. Going digital brings new ease and clarity to working with HEDIS. Look for more news about digital HEDIS as NCQA creates even more digital measures.